Good morning, everyone. Good morning, everyone. Folks in the back, could you have the discussion someplace else or come on and sit down? You can tell I ran a company at one point in my life. My name is Phil Marineau. I have the honor of being the chair of the board of the Public Good Projects. We are a not-for-profit, and we envision a world where all of us, as a society and as individuals, have a much better understanding about issues regarding our health and our family's health, and then are inspired to change how we behave to improve that health our health outcomes. We're going to do that by revolutionizing public health communication using digital media. And we have the capability of really monitoring the conversation around certain health issues and what people believe and don't believe, and then from that creating campaigns to inspire people to know more, to have awareness about these issues and change the course of their health. And we've had a campaign for a little over a year now with Kaiser Permanente trying to reduce the stigma of mental health. And it's been wildly successful relative to any other campaign of its nature concerning mental health. So let's begin by giving you a little sizzle reel on what these two campaigns have been about.
My name is Marie.
Hi, my name is Ben.
Hi there, my name is Martin Mandelamaro.
I'm a musician, a writer, a mother, a poet, etc.
What defines me are the things that I love the most.
But I'm also an artist, a dancer, and a business owner, and all of those things define me way more than the fact that I happen to struggle with anxiety.
My name is Naomi. I have depression and anxiety.
I like to talk about my mental health, and I think it's important overall to talk about mental health so your thoughts aren't stuck up here in your own head.
Talking about anxiety helps me because it makes me feel like I'm not alone.
It's okay, and I hope that you learn that it's okay as well.
Good. So therapy pets and Like One Another in combination resulted in an 8% reduction in mental health stigma. And no other campaign that's ever been run in mental health even comes close to that. And we did it for hundreds of thousands of dollars. The nearest one would be in the UK, run by the government for millions of dollars. So we're quite proud of this. The interesting thing on therapy pets, one of the big rappers of the world, Old Boy, who was in the Super Bowl, liked it so much. He's the voiceover for one of the pets in the animation that we've run, and he did it for absolutely free. So it's quite exciting. So to talk about this, we have Joe Smyser, who's the CEO of the Public Good Project, John Vu, who is the VP of Strategy for Health, Community Health at Kaiser Permanente, and Emily Lord, who's the Chief Operating Officer of the Public Good Projects. So let's begin by John talking about the origins of this partnership and this campaign, these campaigns.
Yeah, I think, Phil, you summarized it well when you said the revolutionary part of this.
Right.
I think and for those of you who may not know, Kaiser Permanente is a large integrated health system. We're in 8 states and Washington, D.C., across the country. And we provide full care and coverage and go way upstream to think about preventative measures and really strive to keep people healthy. And we're a not-for-profit, socially driven, mission-driven organization. So the idea of one's individual and personal health is inextricably linked with the conditions and the external community environment that they're from. We take very seriously, and how do we think about both working together? So yes, we are a provider of mental health services and care, and we treat and diagnose and provide the care there, and we take that very seriously, and we're trying to make sure that we live up to all the principles and ideals there that we can. At the same time, we know that we need to affect the culture around mental health. We know we need to shift knowledge and attitudes and beliefs and thinking about mental health. So that we're never going to be able to treat everybody fully, and we want people who, by the time we help take care of them, that they're surrounded by people and support services in the best way they can. So over the years, we've done a number of things around that. Most recently, we had a campaign similar to do lower stigma called Find Your Words. And that was trying to direct people to resources and tools to equip them as they're facing these issues in their lives, that they're not alone, that there are others that could support them, and that there are ways and resources to support them. But we know we had to go bigger and broader and even sort of a little bit, maybe even sort of counterintuitive to the way we think about this. In some ways, how could we kind of reach audiences that we don't normally reach? And especially us in health or public health, what are the sort of different channels? And of course, social media and digital are huge now, and how are we going to kind of reach people through those audiences? So as we looked around who was kind of doing really breakthrough, cutting edge, even kind of activities in this, we found PGP, our Chief Community Health Officer, who came to Kaiser Permanente a few years ago, had some experiences in working with them, and said, we really need to be talking to PGP seriously about through the strength and expertise and skills that they have, and sort of the knowledge and the wisdom that they've built through other campaigns, could we think about mental health in a different way and reach audiences that we aren't normally reaching? So we can get into a lot more about then where we went from there, but that was really sort of the origin of this as a health provider committed to improving health for everyone, with mental health being such a major issue in our country, with the supply of providers and all of that, and the attitudes and beliefs that we know are out there, how stigmatized it is. We needed to find a way to drive a campaign that would reach a huge audience in a different way.
Great. So, Joe, do you want to talk about what the objectives were and how we went about developing the program with Kaiser?
Yeah. So my personal background, my academic background is in public health. So that's my master's and my PhD, and I was one of those masochists that did the postdoc They're all in public health. And prior to PGP, I spent time at the CDC, the Centers for Disease Control, and then at the FDA, the Food and Drug Administration. And I had seen over the course of my career a lot of public health campaigns happen. We've all seen anti-smoking campaigns, and we've seen campaigns for food and nutrition and physical activity. A lot of those are created by organizations that are very interested in reach and frequency and impressions, media metrics, but they're not interested in actually creating a public health intervention. So they're not measuring it like the CDC or the FDA would measure it, like what are the health outcomes of this big media campaign. And so that's in a nutshell what PGP does, is we do behavior change communication and behavior change campaigns, but they're all evaluated like public health interventions. So that's why Kaiser Permanente was a really, it made sense why we would partner on this effort. But how we started was we did a full review of every campaign that had ever been done in the English-speaking world, so not just the US, that focused on reducing the stigma of mental health conditions. So that took many months. It was a full literature review. If we have any academics in the audience, it was the literature review you're used to. We looked at all the evaluations that were out there, and what we were trying to get at was what works and what doesn't, and what maybe seems like it is a good idea, but is really just kind of a gimmick and isn't really founded in any evidence. Because there are a lot of campaigns that are out there that sort of are checking a box on mental health, but they're not really designed like an intervention, and they're not evaluated rigorously. The next step was we had to create it. We wanted to make sure that we understood the environment that this campaign was going to step into. And so we had, is there anyone whose background is public health in the audience? Okay, we got one public health person in the back. But how many, raise your hand if you're familiar with media monitoring. Okay, it's an industry conference. So we had to create a system that helped us understand the narratives in the United States around mental health. And in public health, that system would be called a disease surveillance system. And if you're not from public health, you would call it media monitoring, which sounds way less creepy. So how we did it was we are sucking up all publicly available media data and from all the different sources you would expect. And we wanted to understand when people talk about mental health, how is it being framed? What conditions are referenced most commonly? Are there categories of stigma? We built that, and what we found once we did that was there are thousands and thousands of people every single day in the United States who are openly talking about living with a mental health condition. And this system had not been built before, so that data had never existed prior to us building it. That was a real wake-up call for all of us because we knew mental health was a huge issue, but we didn't know how many people were openly discussing their mental health and across social media and blogs and everything else. No one had ever quantified that. And so we merged that information that we then had, which was real-time data. We have a dashboard that sees all this happening in real time. It runs 24/7. Has not been turned off. And we merged that with the strategies that we saw from the literature had been effective. And those strategies are essentially, you have to have a contact-based approach. So that's where a person who does not have a mental health condition is exposed to someone who does have a mental health condition, and you emphasize the similarity between the two people. And that last part is really important because you'll see a lot of campaigns out there that are just trying to expose people to someone who says that they live with depression, but they don't focus on that last really important part. Here is why you are similar. Here is why this person could be your friend or your neighbor or your coworker. That's where a lot of campaigns fall flat. The next part was an education-based strategy. So we had to figure out a way to get basic mental health information in front of people who are not going to follow an overtly mental health campaign. They're not going to be interested in following an Instagram account where it's just people talking about their mental health. They're not there. So we had to figure out a vehicle to get basic mental health information in front of people every single day. That was the Therapy Pets campaign that you saw. So we looked at market research, and we looked at what content performs the best in digital media. No surprise probably to any of you in the room, it's Adorable Pets. So we made Adorable Pets the vehicle, almost literally a Trojan horse for mental health facts. And those go out every day. We have LikeOneAnother, the contact-based approach. And then we have community partners. So in the public sector, there's a term called collective impact, and that's where you have community-based organizations and funders and everybody involved on the topic all working together, collectively impacting the thing that you're working on. That almost never happens in media campaigns because it's really difficult because you have to herd all these cats. But this campaign started from the ground up. From the first day, we knew that was going to be important. So all of Kaiser Permanente's community-based organizations across all of their states were given the ability to join the campaign and to get stuff for free and to share it with their own logo and their own messaging on it. So all of these things working together is collectively called action-minded. And we'll walk you through all the different steps and give you more information. But
Phil, can I build on that for a
Sure.
second? Just because it helps with understanding why we partnered with you or thought that you would be such a great vehicle for us. That everything that Joe just talked about, those components were huge attractive parts. There was the mission alignment, which was easy. It was like, okay, great, you believe in the same things we believe. But the fact that they do deep literature review and try to drive this in an evidence-based way, that it's not just fluffy, pun intended, sort of actions, was a huge draw. So as a healthcare
It was
provider,
furry, not fluffy.
that there needed to be credibility and legitimacy to this because, we are taking care of people. There's 12.3 million members of Kaiser Permanente, and we can't just be seen out there as just sort of doing things kind of randomly here. So that it's grounded in such deep evidence was one huge draw. The fact that they had then these sophisticated tools to monitor and understand what's going on out there right now. Tools that we didn't necessarily have, and to be able to do that in such a scaled way across the whole country. And then to have the skills around the actual marketing campaign part of this. I mean, we could have gone to any marketing company to create sort of nice ads and messaging and all of that. But to pull all three of those things together was the huge power of their organization, and such an overlap between our core beliefs and values in terms of evidence, meeting people where they are, understanding, and then being very community grounded and minded in this. So I just wanted to kind of really punctuate what Joe was, the parts that Joe was describing.
Yeah, and can I just add to the collective impact part of that, the community partners are incredibly important, but the part Joe hasn't shared yet is every single person you saw, we post 7 days a week, sometimes more, and all of our campaigns, those are all just normal people. They're just people who we've never paid a single one. They've all either given us their pet and let us tell a story about their pet, sharing their pet's name. Oftentimes their pets have their own accounts and we can tag them and then they share it out. You wouldn't believe how many followers rabbits have. It's crazy. But we are able to have individuals who are already out there every single day talking about their mental health condition, be the person who's out there talking to their community and all of our communities about their mental health condition. So these aren't people we're just, putting stories on or actors. They're all of us. So it really makes an authentic story that's coming up from the ground. And then when we can share it out, it really connects with people in a way that I don't think any other campaign has before.
Great. Good. So I think one of the great topics of our society today is mental health, if not only driven by the homelessness issue as well as gun control. Why do you, John, from a Kaiser standpoint, why is mental health and the stigma of mental health so critical at this particular point, an issue that you want to deal with?
Yeah, you touched on it well there, that it's pervasive into all parts of our lives and our society. There is a cost side of this, and an infrastructure and services that need to be provided. So how do we do that well? How do we kind of start being more effective and efficient in doing that? So, every dollar into X is less dollar into Y. So how do we kind of look across that? It's for health. This is a burden that people carry. So how do we help ease that burden? So just at an individual level, how are we actually making lives better? And that's of course, that it drives us and motivates us deeply. And then just from a cultural standpoint, thinking about the disparities, thinking about the inequities, thinking about different populations. And I think the power of this campaign is able to kind of think about specific populations, those who have been marginalized or left out, or being culturally attuned and sending the right messages to certain populations. And we know there's an unevenness in terms of what people get, how people view this, how people get treatment and support around this. So across the whole sort of gamut of issues related to mental health, from the cost and needs for society to individual health and improvement and impact, to thinking about this in terms of disparities and inequities, all of that matters to us as part of, not just as a healthcare provider, but as an institution that's based in communities. We are present often now times 50, 60, 70 years that we've been part of communities. So how do we show up as sort of a responsible, also sort of corporate citizen in this?
Yeah. It was interesting. I sat in the session before this because I got here early, and it was about religion. And people were talking about spirituality. And I looked up the definition of spirituality, and one of them was loving yourself and loving other people, right? And mental health issues are the same thing, loving yourself and having other people love you. And you know, it's one of the keys. It's amazing, the intersection of the two. Anyway, I'm getting off topic here. So Emily, why don't you talk about the challenges that we faced in putting this campaign together, doing the research, having the insight into what people are talking about and saying, and then how do we really change people's minds here?
Yeah, I mean, it's a long pathway. You know, it's quite a lot to have something and have all of that grounding and having a research and then taking it into a full campaign, and especially a campaign like this, because the work we've done is not being pushed by a paid promotion campaign. So this is almost 100% organic growth. And at this point, we have about 100,000 followers, and we have great momentum. We've been able to build celebrities into cartoons that we're now animating, and they're donating their time and they're providing voices to. But all of those are, building blocks and steps that we needed to get to. And, the first hurdle in all of that is that nobody knew it existed, and nobody wanted to talk about mental health. Right? And especially when you're talking about therapy pets, you're having an audience that, it's almost as if a lot of people shied away from the topic entirely. And so you're trying to find a way, like Joe said, to Trojan horse it in. And you're trying to find a way to get a community who would not want to embrace a topic to start to feel comfort around it. And then you're trying to ladder that up. And this campaign really does kind of build into a ladder. First, you're skittish and you don't really think or talk about mental health, or I don't know anybody with a mental health condition. And then you can start saying like, okay, I see these messages. Really, it's just somebody dealing with anxiety, or I can talk about these things and we're connected and it's okay. And then you can hopefully get exposed to LikeOneAnother, and you can actually see real humans that are telling their stories. And building all those pieces, it wasn't just the technical challenge of putting it all together, but it was building an audience along with that and having them grow and then come along and see that, okay, I can connect with humans. And getting a follower and people online to engage with these different audiences, that's a huge step. And then what we're moving into, which I think we'll get at the end, but we're actually going to be pushing that into advocacy. And how do you become a champion in your own community? And we're going to be calling that, or we're calling it mental health champions. So how do we take you from not wanting to talk about something to talk about it, to owning it, or maybe even talking about your own issue and putting it out there, which is terrifying to a lot of people, to becoming the champion for your own family, becoming that person that someone can come to and saying, I'm feeling anxious today, or, I'm worried about something, can I talk to you? And becoming that trusted person. So building all of that really, it took trust, and it took a long time and years of getting that audience to come along with us. And Joe, I don't know if you wanted to add anything about the technical side of the challenges with it.
So I had mentioned this media monitoring profile that we had built, or disease surveillance system. And that we saw all these people speaking. But mental health stigma is real. It's a huge deal. We all know that. It's such a stigmatized issue that even when we reached out to people who are openly already talking about their mental health condition, living with a mental health condition, only 1 in 10 agree to share their story with the campaign. So that's our ratio. So we reach out to 100 people and 10 of them say yes. And those are people who are already openly talking on a public Twitter account about their mental health. So this is there's a lot of stigma attached. And as Emily mentioned, this is an organic campaign. So it's been in market for about 10 months now, about 100,000 followers across these different sub-campaigns of Action Minded. And if you're curious, so we had no idea how this was going to go when we started. We knew it was an evidence-based approach, and there was a sub-campaign for each one of these, evidence-based strategies, contact-based, education-based, advocacy-based. The pets part's been the easiest. Because people follow the Therapy Pets campaign because they want to see adorable pets. And the bonus is that they get a mental health fact along with that pet. But the whole thing is UGC driven. So we have real people submitting their actual selves in a photo or a video and a little paragraph about their experience. We have enough of those coming in every day that we can share a new one every day, a new person every day. For the pets, it's dozens and dozens of submissions every day because pet owners love nothing more apparently than to share their pet with the world. And so we get a lot of pets every day, and people are doing that because they like the idea of their pet becoming a mental health spokesman, which is what we call them. And how that works is, so all of this was sort of trial by fire, trying to figure it out as we go. But if you're curious, the template that works for Therapy Pets is you share the pet's name, you share a factoid about the pet, and then you share a little fact about mental health, and then you circle back to why that's relevant to the pet. And all these people are just giving us the pet's name and a little fact about the pet, and then it's on the job of a copywriter, a creative person, to make that link between mental health and the pet. But you can imagine, that took a few months to really get to the point where we understood it. For example, we made mistakes. We were snarky one time about a pet, and the pet owner was very upset. So now when we have new staff people come in who are working on that campaign, the number one rule is honor the pet. The pet has to be the hero. You have to treat this pet like it's the best pet in the world, and then we're going to be okay. And for the people, for the LikeOneAnother campaign, what we realized really quickly was we're joining a community of people who take this very seriously, as they should, and we're building an environment of people who are like-minded and want to support one another. So it's a supportive environment where people are talking openly about mental health, and our job is to curate that and moderate it and keep it safe and secure and loving. So there's different communities that are building up around. And if you're curious, the audiences for each one of these are entirely distinct. There is almost no overlap between the campaigns. So that's another learning that we found.
Interesting. So we've talked about how these campaigns have been successful in reducing the stigma of mental health. Can you either Joe or Emily talk about how we measure that? And then maybe John talk about how Kaiser would view that, what success looks like from a Kaiser standpoint, other than that statistic.
So real quick, I talked about the formative research in the beginning, and I talked about how campaigns aren't often evaluated the way an intervention would be. So there are existing measures that mental health researchers and academic institutions use to measure mental health stigma. So we are not recreating the wheel here. Our job was to go through all the peer-reviewed scientific literature that existed, to pull out all these scales and all these survey instruments that have been validated, and then to turn those into one big survey instrument that we use to evaluate the campaign. So that's how it's done. We have 58 individual measures that any mental health researcher anywhere in the world would tell you are correct to use. And we did a baseline before the campaign started, a midpoint, and then a year one point. And that's continuing. That goes through an IRB, which is, do we have anybody who's familiar with IRBs? Okay, so that they're the bane of your existence, but also really important. An IRB is an institutional review board, and they make sure that you are performing research ethically. And they also verify your evaluation protocols. So this went through an IRB, and we basically field this the exact same way a researcher at any research institution would do it. So we're collecting media metrics, reach, frequency, impressions, shares, engagements, but those are performance metrics, and then we have actual evaluation outcome metrics, which are, is stigma being reduced in all of the states that Kaiser Permanente is in, including Washington, D.C. And that's when Phil was sharing the number. All of the variables, we've had high statistical significance across many of these measures, and we've had an average of above 8% change in stigma, which amounts to about a little over 7 million people in the United States now think differently about mental health because of our campaign.
And could you define stigma?
Stigma is basically thinking about people who live with mental health conditions differently than yourself, in a nutshell.
Mm-hmm.
And our ultimate goal with this project, but all of our work, is to do this evidence-based approach and submit it to peer-reviewed journals. So we get published on everything. We partner with academic institutions to validate all of our findings and our research, and then we co-author and publish. And so this will be published. They are glacially slow if you've done that process. But this will be out as well. And because our goal as a nonprofit is to basically share the wealth, we think this is incredibly important work. And if our methods are actually effective, they can be replicated in so many different topics and spaces. It can be really used across, the world. So we'll hopefully be getting these stories out much more and have it in a way that's really just validated by the community.
Yeah, I guess there's pets all over the world, right? I think that the thing I would add too is, to take advantage of this partnership, a lot of the stuff that Joe and Emily have described, we also were able to kind of bring it back to our own psychiatrists, psychologists, our own mental health professionals to say, let's make sure that tone is right, or let's make sure that that won't turn anyone off. And then we also have a huge marketing apparatus too, so the snarkiness or things like that. Or we did also have to be careful about, we didn't strongly kind of say this is a Kaiser Permanente thing, but we also wanted to be sure that that from a sort of a brand marketing standpoint, that we could actually stand behind it in the long run. So there's definitely success around the campaign that we are hoping for and have gotten and seen. Knowledge, attitudes, and behaviors. I mean, that was our number one sort of set of outcomes on this, and we're seeing it all shift. People's knowledge, are they better aware about stats and figures and things you can do for mental health? We're seeing that move. Attitudes, the way people think about your neighbor, your coworker, your family, whatever, I think that's changing. And ultimately behavior. Is someone doing something differently because the stigma is going down, or because they realize that they could help someone, or that they can be helped themselves? And I think the campaign is showing that too. So in terms of what we were hoping to have change here, it really is this shift in the way people think about, understand, and do something.
And how did you engage your own community partners throughout all these 9 states? What was the process there?
Yeah, so as an organization that's been deeply embedded in communities for so long, we've worked with and we try to help improve conditions for health through a number of different ways, whether it be through schools, with health departments, with public hospitals, with community organizations working on everything from green space and city design to better eating, more physical activity, violence, safety, economic opportunity, all of those things. So we have community partners that we've engaged for years and years and years around a number of health and community health issues. And many of them care deeply about mental health and care about a campaign of this sort, but don't often have the budget, the skills, the giant PR firms. These are sort of grassroots organizations oftentimes. So we were able to say, look, we're doing and creating all this anyways. We've got this incredible partner, and they are willing to create sort of the collateral, the materials you could use, whether it be a YMCA, put it in the newsletter and talk about mental health, a school district, in Colorado that is already talking to their teachers a certain way. Let's get it, sort of some of the campaign swag into there. So you guys can talk a little bit more about that, but that's how we wanted to not just sort of have this online digital presence, with individuals and people online, but to really activate our community partners as a way to spread and disseminate more.
Yeah, actually, I can add to that because we had not only the team sourcing people to give their pet, images or videos in their videos, we also had a team dedicated to reaching out to community partners. So every single day going across the country and talking to groups that work in this field. And we treated each one of those groups that wanted to engage with us as its own individual project. So we would sit down with them and we would talk to them about what they needed, and we would go off and make artwork for them or any kind of media videos, and it would all have their own look. We have what's called white labeled, so it would have no logos on it. If there was any logo, it would be theirs, and we would do whatever they wanted, whether it would be illustration or video in their colors, representing what other images or audiences they were trying to get in front of, and we would create it all as just part of our project here, just trying to get across health messages. So we would have the same kind of messages, but it was a collective impact, as in we weren't really trying to get out the word for therapy pets. I mean, we were like, sure, it'd be great if you share that this exists, but it's trying to get out the key health messages. And that was what we were pushing, and so every single week we would have new artwork that would come out that would be created uniquely for a different nonprofit or organization across the United States, whether it be NAMI of Washington, or the Black Mental Health Alliance. We would create something, and then they would use it somehow in their newsletter, at their conferences, across university campuses. The National Association of Children's Mental Health actually used all of our artwork in billboards across Times Square for over a week last year, which is just fantastic. We're able to get the message out in such a huge way, and the reason they did that is because they were told last minute from one of their board members, hey, we have some free advertising space next week. Do you have any stuff we could put up? They didn't have enough money to actually have their own PR or advertising media company, so they didn't have anything they could put up, but they had our artwork that we had already created for them that had illustrations of children and health messages. So we could turn around within 2 hours for them things that we could put up around billboards all around Times Square. And that is an opportunity they could have never engaged on. So so speaking of a challenge, it took months to engage with all of these groups. And it was, each of these were a different project. But the joy that it was to really do this work with them was it was one of the most wonderful parts of the whole effort.
So we're going to leave time for some questions here. We're going into year 2. Do you want to talk about what oh, great. Sorry. Nobody ever calls me. Except bot calls. Sorry. So what's year 2 look like? And also do it within the context of what did you learn from year 1 that you're incorporating in year 2?
So the campaigns are continuing. So each one of the campaigns you've heard about today is still going to be in market for the next 12 months. So there'll be many more pets and many more people. We're evaluating it the exact same way. So we'll be able to compare all of the results from year 2 to year 1. We're going deeper into some of the results that we got in the evaluation of year 1. So for example, audience recall was really high. In the states where their campaign was heavied up. So 49.4% audience recall for a campaign with a budget of less than $1 million. So for those of you who've worked in media, you're going, how in the heck is that possible? And we think it's possible for lots of reasons, but we want to dig into, okay, so let's get really granular on what's going on. Like why is this so sticky? And then more celebrities, and hopefully many more community partners. So basically just doubling down on all the things that seem to have worked really well in the first year. And to add a little bit to what Emily said, one of the things that I think is most interesting to me about this is we have a list in an Excel spreadsheet of all of these evidence-based talking points. So whether you're talking to NAMI or any mental health organization, these are the things that researchers agree people need to know about mental health and about stigma. And those talking points are just tailored and adapted and used across all of these campaigns every month. But because we're giving content away for free to all of these other organizations, what we're seeing is all of these other mental health campaigns and these state health departments and local health departments and community-based organizations are all starting to use our talking points. And I say they're really just good evidence-based talking points, but they're getting them from us. And so you'll maybe see a different mental health campaign, but when we look at it, we know that, oh, that's because we had that conference call with them 3 months ago. So that's been really cool for me to see, is if we can start getting everybody aligned to saying things in a way that the research shows is the way it should be said, rather than, like John said, just kind of fluff. I think we'll start to see a greater collective impact. So that's what I'm excited about for year 2.
Yeah, same here. I think for us, it's just, let's deepen this. Could we bring more partners on, and let's learn more? And the reality was that 9 months, 12 months was never going to be enough. For this to see its fullness and effectiveness, it has to be sort of out there, and thinking about all these different channels. Ancillary, actually, to all this is that we've learned a ton about the way they work, PGP, and all the I mean, we kind of already knew they had all these skills, but to see it actually demonstrated. So sort of partway through this, we said, could we direct your attention towards flu and getting more people to get their flu shots and vaccines? So just sort of as on the side, we launched a whole separate thing. And again, to reach audiences that we normally don't reach. We can put up all the billboards we want, posters, bus stop ads, do commercials, but they were able to actually target some specific populations that we knew were underutilizing, underrepresented in the numbers of vaccines or flu shots that we wanted to get out there. So that's the kind of thing. Also, while we're trying to end mental health stigma, we want to end homelessness and hunger in America too. So we started playing around a little bit with, can we start monitoring maybe what the online chatter is and the media perception and news out there around housing and homelessness and food insecurity? And could we start thinking about maybe there's another campaign that around that? So this is really sort of bearing a lot of fruit that could potentially lead us to a lot of new ways of thinking about driving some of the big issues that we want to focus on for health.
Great. So let's open it up to anyone who has a question. Yes, sir. There's a mic right back there for you.
I'm a psychotherapist, and I work with people who have mental health conditions. And I'd really like to thank you for never using the term mental illness. And I think actually if we in the room want to start eliminating the stigma, that's one thing that you can do, is just get that word out of your vocabulary. Another thing is, I think in some ways, if you're not anxious and depressed when you look at the world, maybe you're sicker than the people who are. In that sense that these people are sort of the canaries in the coal mine.
Right.
That are looking at what's happened. But my question for you is, I wonder if you would address really the proliferation of mental illness diagnoses in the DSM. That's really exploding. And, it's like in the past, maybe you were shy, but now you have social anxiety. And it seems to me the fact that there's so many more diagnoses might have some sort of consequence on that. Thank you.
Well, I'm ill-equipped to kind of address that directly. I'm not a clinician, even though I work in Kaiser Permanente. So, I don't know if you're finding any of this as this sort of
the impact that
dialogue.
at least I've seen, I'm not a clinician either, but what we've seen in general is a much broader willingness to at least speak about conditions. And I would say that's the impact we've seen in our work. And even over the past year, Joe is talking about how people were already talking about this, and they're talking about it every day, but to try to get people to want to speak on a branded campaign about it, but often we see when people have a diagnosis or a label, they feel more comfortable than wanting to be out and talking about it. So we have seen some engagement on that, but I don't know, Joe, if you've seen additional on that.
I think there is truth to what you're saying. But it is, and it's certainly really related to these campaigns. These campaigns are focused, though, like the target audience or the target populations are people who do not live with a mental health condition, because we're trying to focus on where stigma comes from. So it's we do see people who live with mental health conditions often engage with the campaign and talk about their personal experiences. But we haven't really dug into over-diagnosing or some of the points that you spoke about, I think it would be interesting to look at, because a lot of the when we do see negative perceptions, a lot of it is, but that's a talking point that people use that. And I'm sure you would agree, it's sort of it's used as like well, these aren't real. Like everybody's getting diagnosed with something these days, so we don't have to take this as seriously as you're saying that we should. Obviously, that's not true, but there's something. It seems like there's an opportunity there to educate people and to focus on, like, to help people triage what is most important. So yeah, I realize I didn't get specific to your comment, but that's sort of the world that we're operating in.
Yes, Miss.
Hi. First of all, thank you for talking about such an important topic in this day and age. My question is more around the demographics of the 7 million minds that you changed. Do you have a perspective into that? And then two is, there's definitely a pervasive stigma in Asian, Hispanic, and Black communities around whether mental health, mental illness, I should say stick to mental health to the earlier point, whether it actually exists and whether depression, anxiety is just something that is popular now to talk about. So what should be done to reverse that type of thinking in those communities, and have you given thought to that in the marketing?
I know our other panelists will have thoughts about this too. So for the evaluation, we asked demographic questions when people responded. So we do have all that data on, in what demographic variable is most related to a change. I can tell you that the sample was pretty evenly split between men and women. I don't know the race and ethnicity and age breakdown in my head. I apologize for that. It will be published in a peer-reviewed journal, which of course means no one will read it, but it'll get published on the website too. For your point about how different cultures view mental health differently and different racial and ethnic groups view mental health differently, that certainly is true. That's well documented in the literature. How we have incorporated that knowledge into this campaign is finding the organizations that are already reaching those communities and then giving them what they tell us that they need. So we didn't try and wade into the space too much as our brand. We wanted to go to who already had a trusted voice and was an authentic member of that community, and then empower them to do their job, to expand their work. So that was my sense.
Yeah, I think the only thing I can add is I haven't seen also the ethnicity breakdown of our evaluation, but we did recently do a secondary breakdown of, I think it was 18 to 24-year-olds on the evaluation, and across the board they performed even better. Because the campaigns are very generally targeted, right, toward basically anyone who wants to engage. But at that age group, they were significantly better, I think, across the board on almost every metric. So we know that it really resonates definitely with those populations. And I think if we were to look, I think we could probably see if there'd be different variations too. But for us, it was... We didn't want to be inauthentic or throw out like a couple of pieces of artwork that nodded to... We did, for example, do a flight of artwork that was for Black History Month. But the way we presented it was through our community partners and our community partner dashboard, and then like a couple of pieces that were people who were submitting and pushing it out through our campaign that way. But we didn't want to just nod to things and then not actually dive in. We felt like that wasn't super authentic.
Well, and I would say the monitoring we do, one of the values is we discover who the trusted partners are, whether it's digitally or in the community, so that the voice is from someone that our target audience believes.
Yep, that's exactly what I was going to talk about, a reference. I think, and through the organicness of this, a white, young, female, indie star, rock star, you found, and now she wants to contribute. A very prominent African-American rap star, Big Boi from Outkast, found it and now wants to kind of create content for it. And, an African-American actor from The Wire and, other sort of big Hollywood. So we're going to if those are trusted voices for distinct communities, I think you're trying to ride that as opposed to, tokenly sort of creating stuff that just feels kind of like, well,
and to give Kaiser their due, they have a goal is to really change the health disparities among different ethnic populations in the United States, right? And get them to all be the same. A very, very difficult job, but they are day in and day out focused on that.
Hi, everyone. I'm Amy Lee. I'm a stage 4 cancer survivor. So being one of the 5% being diagnosed with cancer under age 50 empowered me to understand a lot of challenges of the isolation and loneliness that, elderly and chronic patients dealing with. Something I experience a lot during chemo where my immune system is completely compromised. It's difficult to get out of the house. So I understand that isolation and loneliness, according to one of the study, actually equal to smoking 15 cigarettes a day. And of course, a lot is like the anxiety, depressions that, occur during this isolated setting, which is lack of exercise, lack of community support. It's very easy to trigger them in their body into, a worse state to fighting the disease they're already dealing with. And then the economic cost is really high in this specific population, especially with all the boomers going, oh. So in your study, I was very impressed by the amount of detailed data that you guys are talking about tracking. So do you guys like tracking, like say, what's their health condition? Do they have any chronic disease? What's their geolocations? How's their situation? Where the transportations? Of course, the age group that we were talking about, the demographics. And then are you able to kind of produce data reports that creates more insights with different group of people, especially this population that I'm deeply care about. Like, what are they dealing with, and what's the both physical, emotional, health impact as well as the economic impacts, and then the cost for your Kaiser system.
I can start. So we have a lot of data coming in from different sources. So one is this formal public health evaluation, which is a survey instrument. Another is the monitoring from different media sources. So through the media monitoring, we can get really granular. We can get down to, in some cases, a city. It has to have a large enough population to generate enough data. But generally speaking, if there's a region that has 100,000 people or more in 2019, those people generate enough data where we can get some insights from it. So across these regions that Kaiser Permanente or KP is in, we are able to see, oh, you know what? In Atlanta, depression and loneliness is framed in this way, and it's spoken about in this way. And here are the people who are engaging with that topic the most. And it's really different than in Hawaii. And it could be like, and here are the differences. So we work really closely with each other to give them that data and to dig deeper into those questions. You can imagine, like, the data is so big, it definitely qualifies as big data. It could keep 15 PhD students busy for a very long time. So that's you can do that, and then on the other side of it, on the public health evaluation side, we don't ask a lot of the questions that you listed, because we built it so we basically built it like if all of you were mental health researchers, how would you have wanted us to build our survey instrument? So that was kind of our first step. Those 58 measures that I listed, there's demographic variables, but it's not what zip code do you live in. We do ask, do you live with a mental health condition, I believe, but we were more interested in knowledge, attitudes, behaviors around stigma. But for the second round, we are digging. It illuminated a lot of things that we wanted to dig more deeply into. But yeah, it wasn't really built to provide that level of geolocation specificity to here's where social isolation is over-indexing. It was kind of out of the scope of what it was built to do. But I think that's one of the things that we saw that seemed interesting to dig into.
Yeah, we did, when we were doing our initial monitoring, look at the prevalence of different conditions, and then we try to frame, and we keep track of it, and we try to frame our content in a similar way. So if there is, a certain percentage who are really thinking about like schizophrenia or anxiety or depression, we're trying to make sure that those are all represented in similar ways, and we're talking about it. And we've also incorporated over the past 9 months, I don't know if it's poorly named maybe, but we're calling them rapid response videos. So we're seeing what's trending out there, what conversations are popping up, and then we're very quickly making content that exact same day that is is reflecting that conversation. So, for example, it could be a celebrity who's come out and talking about their own anxiety or their loneliness. We don't necessarily come out, sometimes it might be about the celebrity, but oftentimes it's us putting out content that's more of health information related to it. So this is what you can do if you are, working with people around people and your friends are feeling really lonely or dealing with anxiety. And this is what we think. So it's a part of the conversation, not necessarily like, hey, look, this person just talked about their anxiety. But we are trying to make sure that we are engaging on that and we are reflective of it.
And to the broader sort of social isolation, I mean, that's obviously something that we've recognized as a vital health issue. So just separately from the campaign as a health system, trying to think about what drives it, what causes it, can we identify that across our members and patients, and then what are the sort of the solutions, interventions that we could deploy to address that, whether in an aging population, aging in place, or if you're suffering from a chronic disease, how do you get the support networks and all of that. And there is one healthy tension, I guess, in this campaign that in some ways people talk about social media leading to isolation. Now we're creating a campaign around this that's through social media, but I think, as you've seen, we've found the effective ways to navigate that. So
yeah, it's interesting that you're mentioning that because I look at the study. They study social media engagement versus mental health issues, and apparently the mental health issues go up when there's more social media engagements, especially for women, and cyberbullying happening more for girls because men, when they get aggressive, they tend to be physical, while women can be, more like online, and so that causes huge mental health issues in teenagers.
Very
actually.
Aware of that too, and we're very sensitive to that as well, and it certainly impacts how we frame our content, and that's exactly why it's like one another and bringing people together, and how we can't see differences in one another. Because we really want to reflect that too.
Just a couple other things that we just because it might be interesting to you all. So just through the media monitoring, I wanted to share a couple of the findings. So for example, when schizophrenia is mentioned in American media and also by individuals on social media, overwhelmingly it is linked with someone who has been diagnosed with schizophrenia is inherently dangerous and violent. Which anyone who works in mental health knows is an extremely unfortunate way that the public is presented this diagnosis. But in news reports and everything else, it's this person was violent because they were schizophrenic. So imagine if you have been diagnosed with schizophrenia, what that does to you and what you carry around with you all day long. Also, when we talk in general as a society about mental health, overwhelmingly it's people, if you look at all the mental health conditions that are referenced in public media, depression is almost always number one. And it's almost always people talking about a personal experience with depression. Depression has impacted them personally or a loved one personally. So a lot of stuff came out of this project that is linked to a media campaign, a behavior change communication campaign, but it was also sort of a research project. And that's why there's this peer-reviewed publication process going in parallel, because a lot of it was we sort of knew anecdotally was true, or we knew from clinical data that we assumed this was true, but we didn't have the data on the population scale that we do now. So there's a lot to dig into here.
Is there any privacy or HIPAA compliance issues that you guys have to deal with?
No, yes, there's a lot of issues, but that's why we went through IRB. That's the role of an IRB is to help you navigate what you can and can't do. Because the only data we're using is publicly available data, we're okay. But if we were looking at like private WhatsApp messages or private Facebook pages or things like that, that would have been an issue. But we steer away from all that stuff.
Thank you for your amazing work. Thank you so much.
I think our time is up. To give PGP a plug, which is my role in life, we've just showed you today what the future of public health communication is going to look like. Thanks for being here today.